All right, folks. So today we're going to be talking about PTSD, race-based traumatic stress, and the trauma narrative. And so really there are a couple of key things that I want you all to get out of today. We're going to talk a little bit about PTSD, race-based traumatic stress. They're not entirely the same thing. I want us to really start to think about how racial trauma might show up or will show up or is showing up in the work that we're doing as mental health providers. And then I want to do a bit of a deeper dive into looking at the trauma narrative as a clinical tool that can be used to address racial trauma when it comes up. Okay, so first let's talk a little bit about PTSD and racial trauma. I just want to start by saying that our understanding of PTSD has evolved over time, and I don't have the time now to sort of get into that evolution. But where we currently are is that the DSM-5 does not consider racial trauma to actually fall under its umbrella unless that the racist traumatic experience was life-threatening, right? And, we can all think of, so many examples of, what it means to be a person of color in this country and how that might put our lives in jeopardy. But, something like repeated microaggressions that a person would experience being, I don't know, a person of color in academia, for example, those would not actually meet the criteria to be diagnosed as traumatic events, even though the results of repeated microaggressions may look similar to trauma in an individual or individuals, right? And so there's some sort of debate about this, sort of some folks are saying, well, why would we diagnose PTSD in response to racial trauma? That's not fair. That's pathologizing. Racial trauma responses aren't pathological or deviant. It makes perfect sense that, you would have all of this negative symptomatology from racial microaggressions and overt racism. Why would we diagnose that at all? And then, the other side of it, though, is that having a DSM diagnosis might be really beneficial. It's, it could then be something that you bill for on insurance and the providers get reimbursed for. To be able to say with my whole chest, look, what you're dealing with is racial trauma. Look, there it is in the DSM-5 or, DSM whatever version. Being able to say that to clients might lend some legitimacy to what they're feeling and experiencing. And then, having a formal diagnosis is a platform for treatment development, right? That's how, if there's a diagnosis, if this is a problem, then the field has to acknowledge it as such and develop treatments for it. Okay, I want to talk a little bit about more about racism, traumatic stress, and PTSD. And again, this is in no way an exhaustive discussion, but I just wanted to sort of highlight some research that has been done on this. So Brian Davis and Ocampo have really argued that racist incidents are traumatic and have similar features to rape and domestic violence. They're both forms of emotional abuse. There's a power differential involved in both things, and the outcomes for survivors can look similar. People can present with somatic symptoms, sleep difficulties, difficulty remembering, feelings of confusion, shame, and guilt. And for anybody on today's call who's ever experienced a microaggression or been the target of racism, you can recognize some of those responses in yourselves. Even in this past year, Carter et al. Was able to demonstrate strong relationships between race-based traumatic stress symptoms and PTSD trauma symptoms. And that actually, they can look very, very similar. Okay, so what else do we do with this, right? So again, current definition of PTSD and even previous definitions, there were folks that felt like, this definition doesn't really get at all the types of trauma that somebody can experience and all the types of reactions they can have. So other folks developed the traumatic stress model in response to this, which included like a wider range of traumatic events and possible responses, and this idea that the event has to be negative, sudden, and uncontrollable, as opposed to just life-threatening, right? And so Carter then took this model and applied it to stress that occurs as a result of racism. And that's sort of, the language that we have now, race-based traumatic stress. Okay. All right. So what are the relationships here, right? Is race-based traumatic stress its own thing, separate from PTSD? Like, what's going on? And the answer is that we don't really know. We think that they're interacting in ways that we don't understand yet, because not enough research has been done, quite frankly. Studies that we've seen with combat veterans of color, report higher levels of PTSD not accounted for by their combat experience, as compared to their white peers, right? Research tells us that Black men appear to be most vulnerable to the impact of traumatic events. And then just overall in the population, there's higher rates of PTSD in populations of color compared to some white populations. So what does that tell us about what's going on and about the relationship between these things? Okay, why is this important? Why do you think? Racial trauma is pervasive, particularly for Black individuals. It is a pervasive problem. It is a public health crisis. And I'm going to go ahead and say that as mental health providers, we haven't been trained to adequately deal with racial trauma in our work. We just haven't been. Okay. All right, so now I want to talk about trauma narratives for traumatic symptoms, right? Okay, so trauma narratives are a common feature of trauma intervention models. And for those of you that are not familiar, a trauma narrative in psychotherapy is the process of having the client sort of tell the story of what happened to them. And often more than once, often many times. There are several therapies that use trauma narratives or some version of them, including trauma-focused CBT, eye movement, desensitization and reprocessing therapy, trauma-centered psychotherapy. So as I said, just some of several that sort of use this tool. One researcher sort of looked at various different contexts in which trauma narratives were used, and they identified these 6 proposed therapeutic processes that are going on that are said to help clients recover from post-trauma pathology, right? They're listed there. Remember those because we're going to talk about them in a little bit. Okay, so I just want to pause and say, so what do trauma narratives for race-based traumatic stress actually look like? They are everywhere. And so I just pulled some examples from Twitter and Instagram, right, of folks documenting their experiences with racism, right? So there are these 2. I could do a whole talk on this, but time is of the essence. Okay, I'll let you guys read those, right? And these are just a handful of examples in a sea of examples, depending on who you follow on Twitter. And actually, I would say that if you're on Twitter, whether you're actively somebody who posts on Twitter or just a lurker like myself, if you don't encounter these or something like these, given your interest in mental health, this would be a start. Following people who post about these things, who talk about these things, who talk about racism in academia, in mental health. This should not be a surprise to you. This is what happens in America, especially to folks of color in academia, okay? All right. So I presented those to say that versions of these mini trauma narratives might also be happening in sessions if you work with any BIPOC clients, right? A client might come in and talk about being followed at J. Crew, or, you know, having their professor say something to them, or, you know, being discriminated against by their landlord or something like that, right? And so the question is there any healing in this process of disclosure? Like, does it help? And right now, the sort of technical academic answer is that we don't know. We don't know. We haven't done the research. This is just one of the many ways that in the field we're sort of failing to reckon with the realities of race and racism, right? So we don't actually know. We only have sort of anecdotal evidence from the work that we do with BIPOC clients, right? Okay. So remember, earlier I talked about, or I presented research on these 6 different ways in which trauma narrative work might be helpful for folks with trauma experiences, right? So let's look at those 6 items and see if they have applicability to trauma narratives around race-based traumatic stress. Like, does this stick? Okay. All right. So, you know, here they are, the 6. And I'm going to talk a little bit about what each one of these are and sort of give my opinion on whether, you know, they would work for race-based traumatic stress or race-based incidents, right? Okay. So the first one is emotional catharsis. That's what it sounds like. You know, just having the emotional release of, like, or as we say in Spanish, desahogándose, right? Like talking about the event, right? So that talking about the event might facilitate an emotional release, right? Would this be applicable for race-based traumatic stress? Absolutely, right? You know, anytime I experience any kind of microaggression, the first thing I'm doing is I'm texting Dr. Risha Gottlieb about it. Right. So, you know, and just that process of release, you know, can be effective, right? Okay. The second one, creation of a linguistic representation, right? So, you know, in trauma, we sort of characterize post-traumatic pathology as a real failure of memory, right? And specifically the disruption of the conversion of sensory experience to verbal and linguistic memory. So the idea is that if you tell the story, create a narrative, you can integrate and organize your sensory and verbal experiences, right? And you know, present a cohesive narrative, and that will bring you some relief. Is this effective for race-based traumatic stress? Yes, absolutely. So much of, you know, racial trauma is the ambiguity of the moment, right? What was that, a microaggression? Well, did I imagine being followed? Like, did I imagine that weird look that somebody gave me, right? And so being able to just name what might be that ambiguity, or sometimes not, sometimes it's blatant. Being able to retell it and integrate it and sit with it can absolutely be helpful for race-based traumatic stress, right? The next of these is habituation of anxiety, right? So, you know, in our sort of original conceptualization of trauma, you know, trauma is this, you know, it's an isolated incident or incidences like, you know, sexual assault or, you know, childhood physical abuse or something that may have happened once, it may have happened a couple times, but we're talking about one concrete thing. And the idea is that as you keep retelling your story, you feel less anxious about talking about the traumatic thing that happened in the past. With racism, it's not quite so simple because racism is ongoing. None of us get to look back and say, oh, that, you know, I got, you know, I experienced the racism 2 years ago and now I'm done with that. That's not how it works, right? So it would be less effective. Trauma narratives would be less effective in this way, all right? So the next one, probably the most important one on my list, I think, and where we come in as practitioners, is the empathetic witnessing of injustice, right? So depending on the training model and where you went to school or are going to school, you know, this idea of psychotherapists and mental health providers is more objective actors, that we don't have an opinion, we don't we don't insert ourselves into what's happening in the room. That is, and there are times when I am more objective and I step back, but moments where a client is discussing a racist incident that happened to them, or microaggressions, or microaggressions plural, microaggressions singular, that is not the moment for you to be objective. And my fear is that these disclosures are being mishandled by us as mental health providers, that we don't know what to do, that we freeze up, and we don't know how to respond. And what I would tell all of you is that actually it is of utmost essence that you call out the incident for what it is, and you help the client to label it as racism, and that it is unfair. Or to even allow for the possibility that it might be racially motivated, right? In the case of these more ambiguous microaggressions, right? It is absolutely essential that we as providers support our clients in that way. Okay. The next of these is just developing of an explanatory account, right? So when trauma occurs, it can be very disruptive to, the way that the client sees themselves and the world and other people, right? And so one of the important things in trauma work is to unpack all of those beliefs, right? And, do cognitive restructuring and, help the client sort of see like, oh, okay, well, this was this bad thing that happened, but now it's over. As we know, with racism, it's not over, but helping them just sort of say, and it's related to the one above, the empathetic witnessing of injustice, helping the client to get to a place where it's like, I can label that as racism, and it sucked, and it sucks that this is going on and that this happened to me. It's not fair. That's a really important thing that we can do as mental health providers for our clients. Thinking about sort of psychoeducation about racism and microaggressions is part of the work that we do. Something I would implore you all to think about. And this last one, notice I have an emphatic no there. In trauma work, there's often this sort of resiliency piece of, sort of thinking about, oh, well, I went through this traumatic thing or these traumatic things. How am I stronger because of it? How am I better because of it? And actually, with BIPOC clients and racism, I don't actually think that's a good way to go. I don't recommend sort of going like, well, how did this incident that you experienced, how did it make you stronger? If anything, that's actually extraordinarily invalidating of the client's experience. And so we wouldn't want to go there unless the client initiates that and may want to explore some of that. But so, in terms of, just to kind of conclude on this, in terms of these different therapeutic processes, as we can see, there are several of them that really do apply. And so it does seem like there could be some like real utility in just in even having clients tell their stories. And maybe not the way we do in standard trauma narratives where we have the person tell it over and over and over to habituate some of that anxiety, but just in the telling, there might be some benefit. But so much of that comes from us as providers being willing to hear those stories and to not, recoil in horror when a client discloses something like that to us, right? Okay, so just to conclude here, some points, trauma narratives for race-based traumatic stress are not going to look the same as more standard clinical trauma narratives, most likely. It is essential to validate the perspective of the client. And the last thing about this I want to say is this idea of this parallel process. Client experiences a race-based incident, a racist incident, a racist microaggression. They have all sorts of feelings: shame, guilt, anger, helplessness, all of those things. They come in, then they tell you about it. You as the provider might feel a similar set of feelings, especially if this is a client that you have more of a longer standing relationship with, you care for, you want to protect your clients, right? We all feel very, care deeply about our clients, right? We have compassion and empathy and love for them, right? So I just want to point out this parallel process because I don't think we talk about this enough. And I think it's really, really important for clinicians within themselves, and they can use supervision or peer supervision, which I'm a huge fan of, to sort of explore some of those feelings and to, acknowledge them for themselves, that like, it feels really horrible, when we can't protect our clients in this particular way. And that's where we really bump up to the limits of psychotherapy, right? And that like the most powerful thing you can do for a client is to just hold the experience, right? And again, as I said in previous slides, name the injustice that you're hearing about. Okay, folks, so that is my talk. Thanks so much. You can email me. There's my email address. I'm also on Psychology Today. Thanks so much, everyone, and have a good rest of your day.